Assalamu alaikum. I am Dr. Shahida. Welcome all of you to my channel Online Teaching of Obstetrics and Gynecology. My today's discussion is Anti-Müllerian hormone, a good predictor of ovarian reserve. Anti-Müllerian hormone or AMH is a glycoprotein hormone secreted by the cells of the preantral and small antral follicles in the ovaries. You have to remember that it is secreted from the preantral and small antral follicles. It is a reliable marker of ovarian reserve, meaning the quantity remaining eggs in a woman's ovaries. AMH levels are relatively stable throughout the menstrual cycle. That means it can be done at any time of the menstrual cycle whenever the patient comes. High AMH levels are seen in polycystic ovarian syndrome, while low levels suggest diminished ovarian reserve or approaching menopause or premature ovarian insufficiency. AMH is commonly used in fertility evaluations and guide ovarian stimulation protocols in IVF or in vitro fertilization. Here is a diagram of anti-Müllerian hormone showing that it is secreted from the preantral follicle and small antral follicle. It is relatively stable throughout the menstrual cycle. It is high in PCOS, low in diminished ovarian reserve and menopause. General reference for AMH on anti-Müllerian hormone levels in nanogram per ml and their interpretation. When the AMH level is more than 4, it means it is high, often seen in polycystic ovarian syndrome. When it is 1.5 to 4, it is normal, indicates good ovarian reserve. And when it is 1 to 1.5, it indicates low normal, may suggest decreased reserve. When it is 0.5 to 1.0, it indicates low, reduced fertility potential. And when it is less than 0.5, it means it is very low, likely poor ovarian reserve. Always interpret AMH in clinical context with age, antral follicle count, and follicle stimulating hormone. Follicle stimulating hormone level measured on day 2 to 3 of the menstrual cycle. If follicle stimulating hormone shows high level, it indicates low ovarian reserve or inverse relationship. If follicle stimulating hormone is less than 8, it indicates excellent ovarian reserve. If follicle stimulating hormone is 8 to 10, it indicates good, acceptable for fertility treatment. If it is 10 to 12, it means borderline, may need higher stimulation. And if it is more than 12, poor reserve, low chance with own eggs, it may need ovum donation. Antral follicle count or AFC done by transvaginal ultrasonography on day 5. Best outcome often seen when FSH is less than 8 and AFC is more than 10. Total AFC count done in both ovaries. When more than 12 to 24, it indicates excellent response expected. 8 to 12 good ovarian reserve and 4 to 7 low response may be suboptimal, and if it is less than 4, very poor prognosis for in vitro fertilization. Follicle at different stages of development, from menstruation to deterioration of corpus luteum. Triple layer of endometrium is good for implantation. Ideal fertility treatment conditions: FSH between 6 to 8 milli-international unit per ml, AFC more than 10 follicles, combined ovaries, and AMH 1.5 to 4.0 nanogram per ml. Thanks for watching.